Hi, thanks for clicking on my video. My name is Tina, and I'm here to talk about occipital neuralgia. I've been dealing with occipital neuralgia for about 3 months now. I had an injury back in April to my neck, and I wanted to post this video because I noticed there's not a lot of patients on YouTube who have occipital neuralgia and who have discussed maybe tips on how to either heal from it or to maybe lessen the symptoms that you have with it. So to start, I injured my neck in April. I woke up in the middle of the night. I had my neck hyper extended backwards, so my head was fully backwards over my pillow, and I injured all the occipital nerves in my neck. So there is the greater, lesser, and third occipital nerves. When prior to this happening, I had spent a lot of time on the computer working, and most of my years in my youth being very slouched over. So I constantly had my head more in this position. And then when I went to bed and woke up with my neck in the opposite position where it was hyperextended, it was pretty much the nail in the coffin with me getting occipital neuralgia. I do recommend, if you do wake up in the middle of the night and your head's fully back, you might want to get checked for sleep apnea. I do have sleep apnea, and what happened was my body was trying to get air, and so I just kept going backwards with my head, and then unfortunately slept like that for a period of time, and then woke up in the middle of it in quite a bit of pain. I did go to the ER when this happened, and they did give me a CAT scan and checked did like manual tests to check to make sure that I didn't have a stroke, because the symptoms that I had, some of them did mimic a stroke. Fortunately, by the grace of God, I didn't have a stroke. So I want to kind of tell you about the symptoms I had before I get into the tips on how I was able to really overcome a lot of the symptoms that I have with occipital neuralgia. It's important to kind of know the symptoms, because Google only tells you very limited symptoms. It says that you will get throbbing, electric shock, pain, stabbing pain, and burning pain from those nerves, and they will extend across your neck because those and across your head, because those nerves are the sensory nerves for your scalp. But when those nerves get injured or irritated, a lot of times they can irritate other nerves in your head and vessels in your head as well. And so with mine, I had a slew of symptoms that continued for about 2 months straight, nonstop. So I have a list with me, and I'm going to go ahead and tell you what those symptoms were, and then where I am now with occipital neuralgia. So the first thing was I had head pressure across the back of my head and on the top of my head. Sometimes that pressure would move. It just depends on day to day, but it would either be strapping across my head or the top of my head, or it would band over to my eye. It really felt like I had a 45-pound weight sitting on my head all the time. That was a constant thing when I first injured my neck. The other thing was that my left eye was not functioning right. I don't know how to really describe it. More so, it was like it wasn't tracking correctly, and a lot of that had to do with the pressure too, because it would band over into my left eye. I did have weakness in my left side of my body, which sometimes would go just to my legs. I was able to walk, but just felt that weakness. I also had nerve pain shooting into my jaw, my teeth, my eyes, my ears, and down into my shoulder. That would be sporadic throughout the day, but would be continuous. I was also hypersensitive to light, sound, and motion. Light and sound felt like somebody was screaming at me. And then motion, if I got into a car, and I'm the type of person who's going to places all the time driving, but it got to where I just could not drive at all. If I got in a car as a passenger, it feels like I'm on a roller coaster ride. So it's very hypersensitive to just about everything. And then I also had a dizziness sensation due to all that pressure in my head as well. I didn't feel like the room was like circling. I just felt like I was constantly swaying on a boat. If I was getting up and walking around my house, I felt like I was dropping from an elevator. And then I had where I couldn't, it was too painful to touch my neck, or touch my head, brush my hair, wash my hair, lay on my head. And then also, with laying down, those nerves are firing across your head. So when you're laying down, you're pushing on them, putting pressure, and it truly hurts really bad. You can't lay on your back either, because you're really right at those nerves coming off at the back of your head, and you're putting pressure on them. One other thing, I could not make sharp movements with my neck. So if somebody's talking to me, I have to move my body with it. If I just turned, it would worsen the symptoms as well. Because of all the pain, and because it was constant from the time I woke up to the time I went to bed, I obviously had no appetite. I also could not carry conversations. I could not understand what people were saying to me because of the pain. I just couldn't comprehend what they were saying, and I couldn't get out my words either. And then one of the biggest things for me was that I felt like, because of all this nerve sensation and my nerves firing, I felt like I was chewing on tin foil. It gave me that sensation in my teeth, and it gave me that sensation in my head as well. And then left me having just brain fog, because I was just so exhausted from the symptoms and the pain. I just felt just foggy all the time as well, along with not being able to have conversations. And then the last thing was, I could not scroll through my phone like normal. Like if you're on social media, I could not just scroll through things, because I just couldn't comprehend what I was seeing, and I was so hypersensitive to sound and light. I couldn't be on a computer. The light was too much, even if I dimmed it down. And then I couldn't watch like shows or movies that were like action packed, where the scenes were changing constantly, because it was just an overload of all my sensory issues that I was having. So now we are in, it's in July now when I'm recording this video, and I have now pretty much have gotten over most of those symptoms. The symptoms I have now are very centralized in the back of my head, right at the base of my skull. So it's just a little area, which means it's the third occipital nerves that are bothering me now. Sometimes they'll buzz a little in my head. It kind of gives you the sensation of maybe having like a back massager that vibrates and putting it on the back of your head. So the nerves will vibrate sometimes, depending on how I slept at night. Which would cause a little bit of issues with my vision and my balance as well. And then sometimes I have slight head pressure at that base of my skull, but it's not going across my head or at the top of my head either. And then there are times where sometimes I feel a little off because of it. It gives you kind of that foggy state. The one thing I still cannot do is I cannot drive. When I am a passenger in the car, I can handle the motion. I can handle sound and light. It's just that with that nerve injury, I can feel the vibration through the road and through the car going through my body, and it causes the nerves in the back of my head to start to buzz, and they'll buzz so much it branches out, and it makes it really hard to concentrate. So hopefully I'll be able to do another video in a couple months and then tell you where I'm at that point. But the symptoms I have now are very minimal compared to what they were, and they're very localized to the back of my head. I can sleep on the sides of my head now without any pain. Don't really have that feeling of chewing on tinfoil anymore, which is great. And then the dizziness too really isn't there anymore. And so I want to go ahead and give y'all the tips of what I did to help myself, and hopefully that'll help y'all if you have occipital neuralgia or if you have family members that have it as well. I want to preference saying by putting this disclaimer in here that I am not a doctor. I'm not a nurse. I'm not a physical therapist. I don't have any clinical license. I'm just here to tell you what helped me, what tips I did to help myself get better, and hopefully it will help you. If any of these tips don't work for you, or maybe if it might flare up that nerve pain, then just stop doing it. But hopefully this will help. So first off, primary thing is I have to give recognition where it is earned. I will praise Jesus for this because I have never had such a debilitating situation as this. I've been through multiple surgeries in my lifetime. I've had health issues, but this was extremely debilitating to where I couldn't work, drive, or even function as a person. And so lots of prayer has been said. I have been persistent on praying to God because I feel like if he can create the world, everything in it, and me, he can heal me from this. And I feel like he's the only one that can do that. I mean, obviously doctors can give you medications and give you injections and all these other things, but there are side effects that come along with that. So definitely did a lot of prayer. I have come a long way, so I really feel like it's important to praise Jesus for it. So the second thing is I want to tell you the tips that I use to help myself. So first off, it is this seems very simple, but it does help. And so you definitely need to get as much rest as you can. Your body needs rest to heal from an injury. It will be hard, depending on your injury, it will be hard to try to get rest when you're in a lot of pain, but try to figure out ways to either, sit up in your bed, sit up maybe on the couch or on the recliner, whatever gives you the relief so that you can go to sleep. Also be patient with yourself. You have to have patience in healing from injuries. You don't want to get yourself so stressed out that your body can't heal. That's another thing too, is try to find somewhere in your life where it's not so stressful. I know a lot of people say, oh, just minimize your stress. It's really hard to do nowadays in this world to minimize stress from work or home life, but really try to find points where you can really keep your body from being in that what is it called, the fight or flight mode. So like when you're home, dim the lights, don't have so much noise going on, watch some movie that's calming. Just make sure that you're minimizing your stress. The other thing is drink a lot of water. You want to hydrate yourself. You want to have those electrolytes in you. Your whole body needs to be hydrated, including your spine. So making sure you're drinking enough water too through the day. I'm very bad about not drinking enough water and still have to get on to myself to do that. And then the other thing is I was given by a neurologist a neurological medication to help with the pain, but I just, for me, I get a lot of side effects from medications, so I did not take that medicine. I chose to take ibuprofen. Now, ibuprofen is very hard. It can be hard on your liver, your kidneys, and stuff. So you don't want to constantly take ibuprofen. It doesn't help for nerve pain, but it does help for inflammation. So in that sense, I know that I had inflammation because I couldn't feel necessarily where the nerve was firing. I just had all these symptoms. So I did have a lot of inflammation in my neck from hyperextending it. So I did take ibuprofen here and there to kind of help with that. So those are just simple things. The main key points that helped to me was to make sure that I keep my body and my posture aligned. So this is something I went to the physical therapist one time. They made sure my neck wasn't locked up. They gave me some tools on how to, exercise my neck muscles. And when I did that, at that time it flared up. My symptoms worse, so I couldn't do it. So they did tell me though to make sure that my posture is aligned. So making sure that, because I slouch so much, that I'm pulling my shoulders back, that my head, neck, and body is aligned, because your head can weigh, I don't know, I think it's somewhere between 9 and 12 pounds or 10 and 12 pounds. Your neck and your body and your nerves are used to that weight. And from what I found out, if you are sitting at a desk and you've got your head like this, or you're slouched over, you're adding an extra 60 pounds of pressure on those nerves. So taking off that pressure really helps. And when I first had my injury, I really couldn't sit straight up. It was just so inflamed in the back there, it made it worse. So yes, at times it would have to kind of keep my head down. But over time, as I started to try to heal, I kept pulling my posture back, my neck, keeping it all aligned the way that it should be. So I took the pressure off of those nerves. It is kind of hard to do. You got to remind yourself to do it throughout the day. If you're someone like me that slouches all the time, it's, when you're sitting on the couch too, making sure you're sitting up straight. And then making sure when you're holding a phone, if you're scrolling through your phone, making sure you have it aligned with your eyes and you're not holding it down or looking down a lot. Maybe you're reading a book, making sure the book is up to. You don't want to put the pressure on those nerves. And so that was something that really worked for me. I do have a neck brace. Doctors don't recommend neck brace with occipital neuralgia because the main thing is that your muscles are locked up in your back and they can cause more problems. And so with a brace, you're not really moving your neck. You don't have that mobility. And then what happens with that is you can lock up those muscles on the nerves. But I did get a brace only because I wore it every once in a while just to keep myself straight and not doing those sharp turns with my neck until I started really feeling like I was healing. So the neck brace that I got, unfortunately I don't have it in here with me. I might get up and go get it so I could show y'all. But the neck brace I had gotten a regular one, but it rubbed on those nerves and it just made the nerves worse. So I got another neck brace that kind of holds my chin and it has a strap in the back and it doesn't really touch those nerves. So I would wear it periodically through the day, take it off, and massage my muscles. I wanted to make sure I still had the mobility in my head, but also was trying to get my body more aligned and me not making those sharp turns until my nerves would heal a little bit more. The second key thing that helped me heal up more was making sure that I was massaging the muscles in my back and neck. So I didn't have anybody in my family to do that because I wanted to make sure that I was putting the right amount of pressure and not injuring myself worse. So it's best for you to do it yourself. With occipital neuralgia, most of the time the nerves are firing heavily because when you injure yourself, a lot of times the muscles in your body will tense up around that injury and to try to keep from you injuring yourself more. But unfortunately, this really locks up on the nerves and makes the nerves fire more. And so I had a very tense back with lots of knots in it. And then my neck was tied up in here, so when I touched it, it really did hurt. So it was locking up on the nerves. So the trapezius muscle, it's in the middle of your back. It will attach all the way up to your neck. And then you have suboccipital muscles as well that will tense up. And so if those are all locked up, they will hold on to that nerve, and it will keep that nerve firing and keeping you with all these symptoms. So I ordered a tool on Amazon. It looks like a candy cane. This is what it looks like. It's kind of a big tool. I use this flat end here, and you can hold it, put it on your back, and you can just massage the muscles yourself in your back. If you feel a knot, you can put some tension on that knot and pull that knot out. So I did this multiple times a day to get the tension off my back from doing so much computer work for the job that I had. It really helped to loosen up those back muscles. I didn't use it on my neck, because if you use it on your neck, you can injure yourself. So with my neck, and this is something I informed the physical therapist I was doing, and she was fine with it too. I would just rub on the sides of my neck, that muscle going down here, and just be real gentle about it, because you don't want to pull too tight, and you don't want to be rough with your body and this cause more injury. I also would put my hands in the back of my neck and kind of pull forward, pull on those muscles. And I didn't go all the way to the base of my skull when I would do that, because those nerves don't really have much cushion or support. So they're really surface level. If you go pushing on that area, you can hit the nerves and you'll feel it fire. So I did a lot of just neck massages myself, and really was gentle with my body, trying to get my muscles to release. And it did work quite a bit, but I did do that a lot during the day. I also use a heating pad. I recommend one that you can heat up in the microwave multiple times. If you got one that you can plug in the wall, that's fine as well. But usually if you have one that plugs in the wall, you have to sit down and you can't walk around with it. So I have one that I heat up, and I just put it on my back, or I put it around my neck, and that helps with my muscles too. And I do that multiple times a day as well. I slowly started noticing over time, as I started to heal, I could actually feel where the nerve was firing. And so right now it's my third occipital nerve in the middle, and it's mostly the left side. So I do my best to kind of stay away from actually pushing on that nerve, but continue to work on my muscles. And when I sleep at night, because I did this at night and I don't want to injure myself again, I have two kind of small pillows that I now put at an angle like this on top of each other. That way, when I'm laying on it like this, I'm not hyperextending my neck again. I do lay on my sides. I do not lay on my stomach, because if you lay on your stomach, you have to have your head to the side. It's putting a lot of pressure on your neck. I don't lay on my back to sleep, because it puts pressure directly on those nerves as well. So I always lay just kind of flip-flopping during the night, laying on my side, and at kind of an angle to keep my head, neck, and body aligned. That has helped a lot. When I get up in the morning, I will pull myself up slowly out of bed, kind of hang over the side, and I will just lightly massage my muscles and my muscles in my neck as well. And then I pull myself up in that posture that helps align your head, neck, and body as well. And so throughout the day, I just be very mindful of how I'm turning my head sharply. If I drop something, I don't bend over to get it, because I'm putting pressure on my head. I typically just squat down, or maybe use my toes or something to pick up whatever I dropped. But all these things that I've done have truly helped with the symptoms that I have. And like I said, you just have to have patience with yourself, and give your body time to heal, and really baby your neck. But you want to make sure also that you're not allowing your neck to not move at all, because those muscles will lock up on the nerve as well. And I believe that's it. The other thing is just making sure you're always, you're keeping yourself as comfortable as you can, and that you're getting that rest that you need. So key points are massaging those muscles, getting them loose, Then also maybe here and there using a neck brace if you want to, so you're not jolting your head around, but I don't recommend wearing it all the time. It will lock up your muscles. And then using a heating pad, and then aligning your posture, and taking that pressure off those nerves. And also drinking lots of water and getting that rest. I also walk around the house a lot to get my balance back. Since I had that dizziness, that helps as well to get some walking in. And I think, yeah, I think that's it. I hope that this helps. I know it doesn't seem like those are major things, but it has helped me significantly with the symptoms that I had for occipital neuralgia. Oh, and one other thing, don't lift, if I didn't say this, don't lift heavy stuff. I'm used to always trying to do things myself, but at some point you have to kind of humble yourself, have your family or people around you help you with lifting something heavy, or don't lift it at all. Make sure you're not straining by, like, maybe, I don't know, pulling laundry really hard out of the wash machine. You know, anything that puts strain, that you can feel put strain on your neck, don't do until you can heal up some. Also, once I started healing up and noticing it, I really started doing the exercises that the physical therapist gave me, to where I would look down, look up, look to the side. There's some stretches you can do. Those things I started doing again because they didn't flare up my symptoms anymore, because I was getting better. And I think that's all. I hope this video helps you. And for those of you that are watching, and maybe you have a family member too that has occipital neuralgia, I definitely will be doing a mass prayer for all of y'all, because I know how debilitating it can be. And thank you for watching my video, and I hope you have a wonderful day, and God bless.